All right, I'll call the meeting to order at 5:03. And then, Mr. Martinez, you just want to jump on?
Yep. Thank you for all being available to meet today. Obviously, we met on Wednesday for our regular meeting and had some discussions and made a couple decisions. And then Thursday, the ISDH webinar kind of introduced some new information and guidance. So let me share the document I sent to you all. All right. And I probably need to make that bigger, right? Okay. So Thursday morning, Dr. Box led the ISDH school webinar, and it was titled "A Time of Transition." They shared some information and updates, such as Indiana's cases and hospitalizations have fallen significantly in recent weeks. Tools are available today that weren't there 2 years ago, such as the vaccinations and therapies. We've seen a large number of asymptomatic and less severe cases being reported. Vaccines have assisted with this. Many infections are not being identified because individuals were asymptomatic or didn't get tested or use at-home tests. The Omicron has a shorter incubation period. And then one of the bigger pieces is that the highest risk of transmission to others is occurring prior to symptoms onset during the first few days of a symptomatic illness, which is resulting in contact tracing usually occurring too late to be effective. So that's a summary of some of the information they shared in the slides, which I sent to you yesterday as well. So based on some of this information, they've updated their guidance for schools and specifically in the areas of contact tracing and quarantine. Universal contact tracing is no longer necessary given the factors above. And the shift now needs to be from universal contact tracing and case investigation and exposure notification to only doing that when you're seeing cluster or outbreaks. So shifting from universal contact tracing to cluster or outbreak-based model. So their recommendations are effective February 23rd. The Indiana Department of Health no longer recommends contact tracing and quarantining in schools, regardless of vaccination status. If schools are made aware of positive cases, they can share potential exposure information with students and families, emphasizing the importance of observation for symptoms associated with COVID-19, but the full-scale contact tracing is no longer recommended. Schools no longer need to report COVID-19 case data to the state. However, isolation of positive individuals for at least 5 days per the CDC recommendations is still to be continued. And the piece about negative tests or doctor's notes is no longer required to return to school. As with any illness, students should not return to school unless they are fever-free for at least 24 hours without the use of fever-reducing medication and their symptoms are resolving. So the message that they kind of emphasized was that we're transitioning from pandemic towards the endemic state. Looking specifically at discovery information, since the start of the pandemic, there have not been any severe cases or cases requiring hospitalization in Discovery students or staff. With the variants and the Omicron variant, mild symptoms have been reported in short recovery time by our parents. And overall, the number of Discovery cases has been low, and we're not seeing any higher case trends occur in the lunchroom where masks are not being worn than what we're seeing in the classrooms where masks are being worn. So considering our discussion on Wednesday that we were already going to make some changes, considering these recent updates and guidance from the Indiana State Department of Health, moving forward, I would recommend that we adjust our COVID-19 procedures and protocols to align with the Indiana State Department of Health recommendations as outlined beginning next week, February 23rd, which would mean we would no longer conduct universal contact tracing or individual case investigations. When we get notified of a positive case, we will send out general notification to classrooms, families, groups, whatever the situation might apply. We will no longer require quarantining for individuals identified as close contacts. but we will continue to follow CDC guidance for isolation of individuals testing positive for COVID-19. As a reminder, what that looks like is you'd stay home for at least 5 days with the initial date of symptoms being considered day 0. An individual may return to school day 6 as long as they're asymptomatic or if symptoms are resolving. Symptoms must be resolving or improving, and student must be fever-free for 24 hours without the use of fever-reducing medication. The cough must be controlled, and the student must be able to tolerate wearing a mask. Continue to wear the mask at school from 6 to 10 days 6 to 10. And then extracurricular activities can resume on day 6 if they're able to wear the mask properly. Symptoms are resolved or improving. It's recommended that they do get cleared by a physician before returning to schools. And then regarding masks, as we discussed on Wednesday, I recommend that we continue as we discussed on Wednesday. We'll move to mask optional after we remain in yellow status for 2 consecutive weeks. As a reminder, this Wednesday, the 16th, we were in yellow. If we're in yellow again on Wednesday, the 23rd, which is next week, that would be the 2nd consecutive week, which would mean we would move to being mask optional effective Monday, February 28th. In the event we see an increased number of positive cases in the school or in the community, we can always return to requiring masks if we feel it's necessary. So that's what I recommend we proceed with as the new information from the Indiana Department of Health. Are there any questions from the board?
I think it's scary because Discovery's always felt so safe with everything, but I also feel like we're kind of in a position where it's what the guidance is from the state. So it's kind of hard to not move forward and follow what they're recommending.
Yeah, I agree. I think it's difficult because we've been living under these strict guidelines for almost 2 years now. And I feel good about this decision following the guidance because some of those trends that we're seeing are what the state is reporting as well as to why they're making these recommendations. And so going forward for every school, it's really going to be up to them to monitor. And then if they start to see a spike in cases, reaching out and working with the local health department to determine if there's any additional steps that are going to be needed to take.
So will we continue to monitor, but just not report the data, just so we could keep a track of everything?
Yeah, so it'll be up to the families to inform us of positive cases. And then if we do get a positive case, and we'll send out some general information. But the message from the State Department of Health is that the contact tracing now kind of shifts to the parent and the individual to oversee that duty and that responsibility because of the differences from 2 years ago to now.
So will we keep the same check-in that the nurse already has? Can we keep that procedure done? I guess like if they have some of the symptoms or?
Yeah, so good question. So if someone reports being sick or having a fever, we would kind of follow the same protocol prior to COVID if someone was sick. They might be sent home. We can recommend that an individual gets tested for COVID if the symptoms are reflecting that, but ultimately we can't force them to take a test. So it would just be that same general illness protocol. They can return once their symptoms are resolving as long as they're fever-free for over 24 hours without the use of any fever-reducing medication.
Mm-hmm. So I don't mean to ask a crazy question, but like even in the case of pink eye or what have you, if a student has to be quarantined or sent home, that would it be similar to that kind of process? I guess I'm asking. I hope I'm making sense. So do we?
Yeah, so it'd be treated like any other general illness, no longer. So my son comes to school and he's coughing and sick. He might get sent home because he's not feeling well or because he has a fever, but he would just return when he's feeling better and he's no longer fever-free. We wouldn't require any additional testing to prove that it's not COVID-19.
Okay.
Now, if a family chooses to get tested and share those results with us, that's great and that's helpful, but no longer is the state saying we should require that.
Okay.
As a step.
So it's almost discouraging families to get tested because then they'll have to quarantine for 5 days if they're positive.
Yeah, that's what I was going to say. That's my worry is that like maybe they have COVID and they're aware, but they just send them to school anyway. But I mean, there's not too much we can really do about that.
Yeah, I mean, it's a potential for that to happen as it is already, right? If families don't want to get tested.
It is, right. Exactly, because they don't have to report the symptoms. They could still send their students to school.
Yeah, that makes sense.
Unless they get sick or something at school, then we kind of know it, going to the nurse's office, but they don't always go to the nurse. My son didn't, one day. So I guess that's where I'm concerned too, even with little people. They don't always are very honest, well, they want to be in school. So I just think it's a really, I know it's time to open up and make that switch. But as long as we're kind of still doing our due diligence, and I think checking in and just trying to keep track as best as we can within these guidelines, I think that that's a safe route. And then, because we're not saying that students cannot wear masks. If they want to wear a mask at school, they still can.
Correct.
So
When we get to that point, any individual is still welcome to wear masks.
Right.
And if kids if they are reported and then they do come back day 6 to 10, will they still be separated at lunch?
So that was a question that was brought up in the webinar, and they said that is not necessary to seat separately in the lunchroom.
That is not what?
Necessary.
Necessary. I thought you said nice.
Sorry, not necessary.
Because from what all we really have is that if they do have it, they just have to really wear the mask the 6 to 10 days when coming back, not necessarily being isolated.
Correct. And part of that rationale, again, is because the most contagious part is actually occurring prior to symptoms developing. And so the point about the contact tracing coming too late kind of matches up with some of the case trends we have been seeing here at school, with positive cases showing up 10, 15 days after another positive case in the classroom. Again, not to say that we know for certain there's transmission, but we're seeing some of the same data that they recommend, or that they're seeing, basing their decisions on.
Well, I feel all the confidence if you all see something that you would kind of have another special board meeting if we need to make some changes. So I think that we've been pretty consistent in staying on top of this whole COVID situation and making sure that we do our due diligence. So I definitely feel comfortable in that if, again, if you guys see something in the schools, that we'll be notified and we could change accordingly.
I agree.
I'll move to accept it if we have to do that. Do we need a motion?
Yeah.
Does any other board members have any comments or?
I'll second it. Then if anyone wants to say anything else.
All in favor?
Aye.
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 And then, okay, so motion accepted.
Okay, so we will get notifications out to staff and families this evening to update them. And then just additionally, some additional information that they shared as part of this transition process. As I shared, they said the focus now turns on public education, making sure everyone's aware of the importance of vaccination and other health strategies, protecting others who might be vulnerable. So they're going to be working on additional information that can be shared with families. As a reminder, individuals who suspect a COVID-19 infection should get tested, isolate following CDC guidelines, then rapidly notify their close contacts if they are positive, and then seeking healthcare if at a higher risk. The one other piece that they shared is they are going to be working on a home testing program for schools. So right now they do provide Binax kits to schools who want to utilize the test, but this program is designed to provide tests for schools to send home to families. So say someone appears to be symptomatic, the school can send a test kit home to the family. And if the family wants to administer the test on their own, they can. The data, the results still does not get reported anywhere, but it's just another way of allowing families who want to test and maybe don't have the resources or want the test and have access to those tests. So they will be unrolling that here in March.
I think it's interesting that they don't want at least some level of reporting, just because I think they have learned a lot by the reporting. But it's
Yeah.
probably overwhelming for them too. They're struggling with staff. I mean, I
Yeah,
don't know.
they're altering a lot of their operations.
Yeah.
Is some of the stuff they talked about, even their testing sites. So it looks like they're starting off by pulling back on some of the school data.
yeah,
Are they still going to be reporting out the numbers from the state as far as like?
Yeah, I
high
think
school-
the overall dashboard, at least from my understanding of what I've seen, the overall dashboard will still be there. It's just the school information.
And if you get a chance to watch that webinar, if you can, there's a lot of good information in there. It was pretty thorough.
Yeah, the Q&A is always helpful too, because they ask the questions that maybe aren't clear in the presented information.
Ernesto, is that available to the public? Or
Yeah,
is
it's
that
on their
just something-
website. I can send a link
Okay.
to everyone.
Well, I think you did send the link. You sent
Okay.
the link this morning.
Yeah, you just
So
have
I
to go
did-
into, the link may have been to the live, so I think if you click on the recordings, it lists the back to school webinars by date.
Could you include that link with the email you send out to the families?
Good idea.
Yeah, I was going to say that too, as well as even a few quick Q&As, because a lot of people don't click onto the link. So if it's a few questions that we think that families may have, just so they could see it, because I know like the Times had circulated an article, but people just misinterpret it a lot. So it was some panic there. You know what I mean? So
Yeah,
sometimes it's
Well,
blurred.
why don't I start by the link to where the webinars are and the link to the press conference? And then let's see what additional information they have for us to share with families, and we can go from there.
Right, because they said they're going to
So-
come up with more stuff for you to share, right? So I'm looking
So our
at-
families that are on quarantine right now, students, will they be notified that they could return to school?
Nearly all of them would have been fine to return on the 23rd anyways because of the long weekend.
Okay.
But yes, Nurse Burt will work on making sure everyone is aware who this impacts.
And then if families do choose to quarantine the longer amount of time, will they be penalized for that?
I don't know if that was specifically asked or addressed. That's something that we can reach out to either the local or the state level and see what their guidance is on that.
All right. Thank you guys for coming together and figuring that out.
sure.
No problem at all.
All right, have a good weekend, everyone.
All right.
Thank you.
Thank you.
Bye-bye.
All right.
Meeting
Bye.
adjourned.
Bye, have a good weekend.
Bye, Dr. Moore.
Ah.